Every year, about 6 million cases of cancers are reported worldwide. In this 21st century, cancer remains one of the most feared diseases, affecting approximately 1 in 5 individuals during their lifetime. Among various forms of malignant tumors, lung cancer takes the lead, followed by colorectal, breast, and prostate cancer. Now, according to ancient wisdom of Ayurveda, cancer is believed to arise from disrupted metabolism and imbalance of bodily elements, resulting in abnormal cell division and growth. This in turn leads to the depletion of vital life forces known as ojas or the vibrant energy within the body. Ayurveda is a science of life with historical roots in the Indian subcontinent, and Ayurvedic treatment have also been practiced in Western countries as well. Let's explore the insights of Ayurveda on cancer management and how Ayurvedic medicine or herbal remedies help to retard the process of cancer from our esteemed guest, Dr. Lima Mathew, an Ayurveda oncologist at Saptharji Holistic Cancer Center, Karnataka. Doctor is also the founder and director of this cancer center. Dr. Lima's expertise in Ayurveda, along with her extensive knowledge of conventional cancer treatment, allows her to create individualized treatment plans that integrate the best of both worlds. Hello, I am Dr. Harshita, your host, and today we will have an engaging session with on the topic role of Ayurveda in cancer treatment. And welcome, Dr. Lima. We are honored to have you with us today.
Thank you.
So let's start the session. So, Doctor, how does Ayurveda complement conventional cancer treatment, and what specific therapies or approaches are commonly used to support cancer patients?
Well, Ayurveda is the most widely used complement and alternative treatment in India. At least 80% of the cancer patients, they take Ayurveda during their treatment journey. And so Ayurveda, it can be either used to complement the treatment or as an alternative treatment when conventional therapies do not work. So how does it complement this? Most patients face tolerability issues during the conventional treatments like chemotherapy and other therapies. So the tolerability issue, it might be because of the fragility of the patients or the added comorbidities. So this complication itself, it increases the risk during the treatment, and this might refrain the patient from continuing the conventional treatment. So there will be a lot of gap, and this in turn will affect the treatment outcome. So if Ayurveda is added during the conventional treatment as a complementary a supportive therapy, this might it might help reduce the side effects, adverse effects, and also improve the treatment outcome. And thereby the patient will have a better quality of life. And also in some patients, removal of the tumor is not possible because it is locally advanced, either with or without metastasis, or sometimes blood vessels are also involved in it, which again prevents the tumor from being removed, or due to acute inflammation that's surrounding the tumor area, that also might prevent the surgery. So in such cases also, you can add Ayurveda as a alternative treatment, or also to support the treatment, thereby reducing the inflammation, and later it might be possible to remove the tumor because tumor burden might come down. Also, in those patients who are undergoing complementary treatments like chemotherapy and radiotherapy, especially radiotherapy, there are a lot of toxic metabolites that are produced as a result of the treatments. Okay, so free radicals are produced in the body. Lipid peroxide levels will go up. So this will affect the quality of life of the patient once the treatment is over, even during the treatment. So Ayurveda has a branch called Rasayana therapy. It is the branch that deals with prevention and treatment of diseases. Especially we use this in geriatrics. So this Rasayana therapy, it contains all the immunomodulator drugs herbs, etc. So if these herbs or these herbal combinations are given to the patient either during the treatment or just before, like 5 to 6 days before the treatment, this will help a patient a lot to reduce free radicals, to improve, to reduce oxidative stress, to improve the outcome of the treatment. Also in radiation induced mucositis and other complications, this does a wonderful job. So this is one way we can complement conventional treatment. In the other way, even after cancer treatments are over, cancer survivors, they have low-grade inflammation in the body, which might lead to recurrence of cancer in the future. So this can be prevented by administering Rasayana therapy in the cancer survivors.
Yes, thank you, Dr. Lima, for sharing your insights. It's fascinating to learn about the potential of Ayurveda therapies in providing holistic support to cancer patients. And
Yes.
moving ahead, doctor, what are the potential benefits and limitation of integrating Ayurvedic principles into mainstream cancer care, and how does it address the holistic needs of patients?
Yeah, benefits, as I've already discussed, it will improve the quality of life both in patients undergoing treatment as well as in cancer survivors. Ayurveda can be used as a preventive as well as a treatment measure. So even in patients who are diagnosed with pre-malignant conditions, if Ayurvedic medicines are given, it actually prevents the progression of this pre-malignant condition into malignant condition. Okay, that can be reversed. Also in patients undergoing treatment, like I told you, all these side effects can be managed. Patients' symptoms like fatigue, lack of appetite, and some patients might also face a lot of pain. So Ayurveda has a better pain management system, and all those symptoms can be managed side by side. Also, myelosuppression is a concern during treatment. So this hematopoietic system can be activated by Ayurvedic medicines. So myelosuppression can be prevented. And so that is one way it helps the patient in a whole. Also, Ayurveda does not focus just on the disease. It is not an illness focused medicine. It focuses on a person. So person as a whole, the body, mind, spirit, the entire system is taken care of during the cancer treatment. So patient will be stressed out. They will have a lot of questions, a lot of queries, a lot of worries. So all those things will be taken care by the medicine, because like I told you, Rasayana therapies, all these medicines that we use in Rasayana, they are adaptogens, they are immunomodulators, they are anti-inflammatory. So all those the physiological system of the body will be taken care. So appetite will definitely improve, the patient's performance status will improve. So a lot of changes will be seen, and patient also feels better, because most patients, they look towards a natural way of healing when it comes to cancer. So patient satisfaction will be improved. And limitations like both the systems, the conventional system and Ayurveda, has two different basic philosophies different, so fundamentals are different. So it's not an easy task integrating, because even though they have a lot of concerns regarding safety and efficacy of Ayurvedic drugs, and even if studies are conducted, they are unreported, unpublished. A lot of misinformation is present in the online and media regarding Ayurvedic medicines. A lot of some people who are quacks, not doctors, self-made doctors, who claim to cure cancer in the name of Ayurveda. So a lot of such things are happening. That is why it's not easy to integrate both the systems. Also, patients do not find adequate information regarding what is the best medicine to take. So all those things are the limitations.
Yes, doctor. And how do you approach personalized treatment plans for cancer patients using Ayurvedic principles, considering the individual variations in cancer types and stages?
Yeah, cancer, it is of different types, different stages. But when it comes to Ayurveda, the theory of Ayurveda depends on bioenergies, that is Tridosha. So Ayurveda, like I told you, according to Ayurveda, health is not merely the absence of disease, but it is the optimal functioning of psychophysiological system, the tissues, the strength of digestion, the proper elimination of waste, and also immunity. So if there is an imbalance in any of these elements, it might lead to dysfunction, inflammation, and progression of disease. So Ayurveda looks at each individual's genetic constitution, which we call as Prakriti. Okay. So based on this Prakriti or the constitution of the person, we decide medicine that is needed for each individual. Even if two individuals are having the same type of cancer, the cancer is spread to the same location, even if everything is same, still the medicine might vary from person to person. That is mainly because of the underlying constitution. Okay. So the medicines are prepared based on the person's doshic involvement and many other factors, their appetite, strength of the body, strength of disease. So many factors are involved in deciding medicine. So there is no a protocol in Ayurveda which follows the same, which gives the same medicine for all the individuals of the same cancer. So we study the person in detail and then come up with a decision as to what medicine works best for this particular individual with a particular cancer.
Yes, doctor, and it's crucial to craft personalized treatment plans for cancer patients using
Yes,
Ayurveda
definitely.
principles. Yeah. So, doctor, what challenges and opportunities do you encounter while collaborating with conventional oncologists to create integrative cancer care plans that incorporate Ayurvedic interventions?
Integrated cancer care is the need of the hour because, like I told you, most patients are looking towards a natural way of healing. So, patient satisfaction is very important. Definitely, without telling their oncologist, most of the patients are consuming alternative medicines. So, it is best if they are informed of what is the best medicine to be taken. Okay, if everything comes under a roof, I'm not just talking about Ayurveda, it can be naturopathy, acupuncture, some massage therapy, even like there are some other complementary therapies which works better in cancer patients. Okay, if a patient takes not just conventional medicine, if they take all the other complementary therapies together, so their treatment results will be better. They'll have a better quality of life, better survival, and we can give them, lifestyle modification, better dietary advice, all that. So integration is very important, but it's not easy in India, like I told you, because of there is a mistrust between these two systems of healing because of the fundamental differences. So we follow different therapeutic approaches, and Ayurveda is not much evidence backed. So evidence-based studies are needed in Ayurveda to prove that certain herbs work to cure or reduce cancer. And moreover, Ayurvedic medicines are not cytotoxic. They work in a certain fashion to reduce the tumor burden, but unlike allopathy, it is not very much precise. Allopathy has a fixed system, a precise biological understanding of what is a disease, also about the genetic mutation and what works well. So it's not the case with Ayurveda. So to conduct a rigorous clinical study, we do not have certain policies, and it's not an easy thing. And most of the combinations, they might have so many components, so many herbs joined together. So to study each herb in detail regarding its chemical constitution, so what works in the cancer, it's not a simple study. It might take years together, and that is where we are lacking. Okay, and otherwise it's a fantastic thing, integrated oncology. There are centers in India who have integrated both allopathy and Ayurveda and who are doing really well. So even if clinical studies are conducted, so most of them go unnoticed or unpublished, or the population size is not large enough to prove that this works in cancer. So that is one benefit. It has both benefits and limitations. So that is one limitation. And if you look at the brighter side, patients will feel much better and also cost effective. Ayurvedic medicines are very cost effective compared to conventional medicines.
Yes, Dr. Lima, and the ultimate goal is to provide comprehensive and patient-centered integrated
exactly.
care.
Yes. So I think in India we need more Ayush centers who are focused on cancer care. More trained doctors are needed. We need more policies, lack of funding. All these are the problems, the limitations that we face in integrate.
Coming to the last question, Doctor. Can you share any success stories or case studies where Ayurveda has played a significant role in improving the quality of life and outcomes for cancer patients?
Yes, definitely. I have a metastatic breast cancer patient, a female patient, age 45-year-old. So she came to me 2 years back with brain metastasis. She was already a diagnosed case of breast CA post total mastectomy. She underwent cycles of chemotherapy, and she was also HER2 positive. So all that uh, chemo was done, and within 6 months she had a recurrence in the brain, so because of for which she underwent the whole brain radiotherapy, and even after that she did not find much relief. She had severe headache and balance related issues. She had midline shift in the brain, so all those issues. Then she came to me finally. Most patients come to us at the end stage when nothing else works. So I started with my treatment. She was on hormone tablets. I asked her to discontinue the tablets, and then immediately she started feeling better. So now, according to her condition, the survival rate was predicted to be up to 6 months. Maximum was 6 months. So the patient is fully alive. Her performance status has improved, and it's been two years, more than 2 years, 3 months now. The patient is working. She goes to her office. She does everything by herself. On and off, she has mild headache or some digestion related issues. Otherwise, the patient is doing fantastic. She's doing really great. So that is one thing. It has improved her quality of life, reduces symptom, and even in the follow-up MRI, her tumor has not increased. It has actually come down.
Yes, doctor, and it's heartening to hear about these cases where the integration of Ayurveda has made positive impact on the quality of life during the challenging journey of cancer treatment. Yes, doctor, and now we have arrived towards the end of today's session. So, thank you, Dr. Lima. It was indeed an informative and interesting session. And thank you for your time and sharing your thoughts and experience with us.
Thank you, Dr. Harshita.
Yeah, and a huge thank you to our audience for tuning in. And before I conclude, I want to bring your attention to the MedSynapse platform, our vibrant hub that's redefining the healthcare landscape. It serves as an invaluable resource for professional doctors like you, offering opportunities to engage in meaningful discussions, connect with expert doctors, and be part of advancements in healthcare. Why wait? Explore the MedSynapse platform right now to make the most of these remarkable opportunities. And feel free to drop your comment in the section below if you have any questions. We'll be happy to provide you with an answer you seek. Until next time, take care and keep advancing in your medical journey. Goodbye.